cornea transplantation replaces the clarity of the cornea using a donor. Unfortunately, it is the only way of restoring vision once the cornea becomes opacified or hazy. So it is the only treatment available for end-stage cornea disease. Traditionally, cornea transplantation, like I mentioned, is replacement of the diseased or opacified cornea. The original technique is known as penetrating keratoplasty or a full-thickness cornea transplant. This requires a full replacement of the entire cornea, and that is quite a big surgery requiring removal of the diseased cornea as well as sewing or suturing the cornea or the donor cornea onto the recipient. But fortunately, in recent years, we now have selective replacement of the diseased cornea. Decimase membrane endothelial keratoplasty or DMEK is the further evolution of endothelial keratoplasty in the fact that it is a replacement of the diseased inner layer or endothelium with a much thinner donor. And because the thinner donor is involved, the patient's vision recovers faster and there's less risk of rejection. So the patients enjoy a better post-operative recovery. So before decimase membrane endothelial keratoplasty, usually we evaluate the patients carefully and thoroughly to make sure that the patient doesn't have other risk factors such as glaucoma or other eye problems. And usually we give the eye drops to the patients 1 or 2 days or even 1 week before the surgery to prepare the eye for the transplantation. So after endothelial keratoplasty or DMEK, because the wound is very small, sometimes we do not even need a suture or sewing of the wound. So the wound recovery is actually very fast. Within a week or 2, the patients actually recover. However, the patient's vision may take up to 3 to 4 weeks to recover. That's because the cornea or the donor on the inner layer takes time for it to stabilize. So just after a DMEK surgery, often we require the patients to lie down flat with his posture face up for at least 1 to 2 hours while we check the intraocular pressure. Patients require eye drops at least 4 to 6 times a day for the first few weeks. And we like to monitor our patients for the first week, 3 to 4 weeks later, and almost every 3 to 6 months after. And once the condition has stabilized, actually we only need to see the patients once a year. After a DMEK surgery, the recovery is a lot quicker compared to traditional cornea transplant. This is because the wound is a lot smaller and we do not need to remove sutures. There's lower risk of infection and the patient's vision actually recovers a lot faster. Just after DMEK surgery, we do want to look out for basically whether the eye turns red or painful and whether there's cloudy vision, because this could be signs of either graft detachment or even rejection. It's important for patients after DMEK surgery to continue using the eye drops on time as prescribed by the cornea specialist, because this will prevent complications from happening. So the most common complication after DMEK surgery, for example, is detachment of the donor. So because we are replacing a very thin inner layer of the cornea, sometimes the layers do not stick very well. Fortunately, this can be easily fixed with a repeat air injection inside the eye, which takes about 5 minutes. The second most common complication is rejection. So even if the surgery goes very well, in about 1% of the patients, the donor and the recipient do not match. So the patients may experience blurring of vision, a bit of redness, and fortunately, most patients respond well to steroid eye drops. For traditional penetrating keratoplasty or full-thickness cornea transplantation, recovery can be taking a few months because the wound is very big and it requires a lot of suturing or sewing of the cornea, and these sutures may need to be replaced. Sometimes we need to look out for post-operative complications such as suture loosening or even infections. So sometimes recovery after a traditional cornea transplantation can take 6 months to even 12 months. The main advantage of endothelial keratoplasty or even Descemet's membrane endothelial keratoplasty compared to traditional full thickness penetrating keratoplasty is number 1, the wound is a lot smaller. Number 2, the patients recover a lot faster. Number 3, their vision recovers a lot quicker. And number 4, the post-operative care after surgery is a lot less cumbersome, it's a lot less tiring. So I think there are many ways to maintain eye health. Of course, one important aspect is to have regular eye check or regular eye evaluation with the eye doctor so that you can detect early problems such as glaucoma or corneal disease. And of course, frequent measurements of the eye is also very useful. And eye hygiene, so basically taking care of your eyes, is also very important.